Hi, my name's Beth. I'm 44. I was a primary school teacher, very fit, very healthy, active mum, and was delivered the devastating diagnosis in November 19 that I had triple negative breast cancer. I've not got the largest of breasts, but I was very on it in terms of checking. I've also got quite fibrous breasts, so any kind of lump or bump was something that I would monitor. And ironically, I'd only been to get a lump checked out a couple of months earlier, and was given the all clear. So when I discovered the kind of the newish lump in September 19, I wasn't overly phased, but did the kind of the standard go see my doctor. He too, given my history of fibrous breasts, wasn't overly concerned and said, you know, you are of that age, it's perimenopausal phase, lots of changes are taking place, let's monitor it for a month. So another month passed, went back again because the lump still had not changed. It was a relatively small lump in size, say about 1.6 centimeters. And at this juncture, he said, okay, we need, you know, a referral to the breast clinic. And with this appointment came ultrasound, mammogram, and biopsy. Again, ironically, the lump didn't show up on the mammogram because it was basically where your cup edge would sit of a bra line. So that, again, is something very much to be aware of when you go for routine mammograms, that they don't actually capture everything, and that it is really important to know your breasts and to feel your breasts. Then had the kind of 1 week wait for results. And again, at this point, still not overly worried because I thought, oh, you know, it's just, you know, it's going to be the same news delivered as before. To the point of my husband did want to come with me, but I said, look, you don't need to come into the appointment. But upon sitting down and seeing the face of the breast surgeon who delivered the news, she asked me if I had anyone with me. At that point, I think I went into shutdown and basically said it's not good news then. And went back outside to the waiting room, called my husband in, and was told that I had triple negative breast cancer. And again, I think so many people think breast cancer is just one type. And I, for one, was, you know, completely ignorant of the fact that there are so many different types. Triple negative is very aggressive. It's got very poor prognosis. Tends to affect the kind of late 30s, early 40s age group. And unfortunately, with, you know, the pressures on the NHS, that news was delivered with, you know, a 10-minute appointment. So a life-changing piece of news that really needed a lot more explanation. Didn't really cut it. So went away. Luckily, I have a very supportive family. My sister is in the medical profession and actually worked at the hospital that I got the diagnosis. She too wasn't happy with, you know, what I kind of came away with. And they had very kind of loosely outlined the treatment plan. To cut a long story short, triple negative has a gold standard treatment plan. It's usually chemotherapy first because of the way in which the cancer spreads and how aggressive it is. The chemotherapy basically treats the body systemically, and then you go for surgery and then radiotherapy. My local trust wasn't going to do it in that way. We were then fortunate enough to book an appointment with someone who knew a little bit more about it. And I was scooped up by Frimley Park, who were absolutely brilliant. But as you can imagine, it's pretty tough when you are basically told that you have got a very slim chance of coming out the other side. You are literally catapulted into a kind of conveyor belt of scans, appointments, blood tests, and it's like rabbit in headlight. Your life goes on pause. And it has such a wider impact. You know, I had a 10-year-old daughter, husband in the army, always a very independent person, and you're kind of put into this position where, you know, you are going to have to be reliant on so many people and so many systems. I was also due to start a new job, which had to be canned because the chemotherapy treatment is incredibly arduous, basically 5 months. And it totally smashes you on so many levels, emotionally, physically, spiritually, and it is literally taking one day at a time and fighting for your life. You know, I was very fortunate. The team at Frimley Park were amazing, but then towards the tail end of my chemotherapy, COVID kicked in, which added extra stresses and pressures. One of the greatest ones being that surgeries were getting cut left, right, and centre, because of the spread that my cancer had shown on all the diagnostic scans, in that it had spread to my lymph nodes, it had spread to the nodes in my chest wall. I knew I needed extensive surgery. Frimley Park, because of various governance issues, weren't able to do the surgery that I knew I needed. Fortunately, again, I was my own advocate alongside a very supportive family, and I sought a second opinion from a professor in London, and he too agreed with what I needed. And I was very fortunate enough to be scooped up by Joe Franks at UCLH, who carried out the op. So this is third hospital within a cancer journey, which is hard enough as it is without having to juggle all of this. But again, I have to be thankful that the stars aligned and that I had such wonderful people to treat me. So I was treated at the Wellington because obviously measures were put in place to safeguard cancer patients. And I had a left mastectomy, full lymph node clearance, and then was beyond blessed to have had a complete response to the treatment, which is not always the case. And with triple negative, I knew that for my best chances of survival, I needed that complete response. So that then took us up to May time. Then I had the 3 weeks of radiotherapy after that. So that took me up to the end of summer, and I'm due imminently to have a second mastectomy for preventative and symmetrical reasons. So that's a very short version of probably the toughest 2 years of my life and my family's life. Okay, so in terms of kind of supplementing the kind of the medical route, for me, that was really, really important. When so much was taken out of my control, I had to do as much as I could to feel that I was doing everything that I could to, you know, give me my best chances of being there for my family. So I think one of the biggest elements is the impact of the treatment on your body. Chemotherapy is there for a reason. It does a job, but alongside the job of killing the cancer cells, it also has an absolutely devastating effect on your body. So I sought, with the approval of my oncologist, who was brilliant and really open-minded, I sought an excellent homeopath who basically worked with me kind of every couple of weeks, because as you progress through the treatment, the side effects change. And he prescribed me homeopathic remedies that basically would help my body cope with the treatment and get through each kind of chemo infusion, which I really do believe helped immensely. So many ladies who were on my timelines had to have blood transfusions, had to have basically gaps in their treatment. But despite being on my knees, I made it all the way to the end without any gaps, which was, you know, I was just incredibly grateful for. In addition to that, the kind of the mental side of things and the emotional side of things, it's probably one of the most stressful positions anyone would ever be in their life. And I looked into Reiki and found a wonderful Reiki healer who I had kind of one-to-one sessions with pre-COVID, and then thereafter we've continued with distance Reiki. And that was so valuable in terms of helping me to relax, helping me to see things in different ways, and just the power of what she was able to tune in to me with each and every week just blew my mind. And I, again, am incredibly grateful, because I do believe that got me through treatment, and it's also given me a whole different perspective and outlook on life. I mean, cancer changes you. There's no two ways about it. But to do it alongside such amazingly skilled professionals who are helping you navigate your way through this absolutely hellish journey is something everyone should have access to. Obviously it costs, and not everyone has that means to do that. But yes, the power of the homeopathic kind of routes, the Reiki routes, just phenomenal. I also took CBD oil. I walked as much as I could. I overhauled my diet. I did yoga as much as I could. And again, that very much helped me with connecting on a spiritual level, and helping me to kind of just get through days. And not so much kind of complementary medicines, but being with other ladies and being able to talk and just being with other people who are going through the same things as you, again, is incredibly powerful. And I feel unbelievably grateful for everything that I've had access to. In terms of the kind of the spa world, the beauty world, the kind of the massage world, I learned very quickly that people were very tentative and not at all comfortable in taking me on for any treatments. So, for instance, my sister had a birthday celebration at a spa, and it was in the very early stages of chemo, so I wasn't overly poorly, but there was a big no-no, as in they were not happy to do any kind of treatments on me, and yeah, just a real shame, because you know, more than ever, when you're going through this, you need help with relaxation, you need help with your anxiety, depression, and all of those luxuries that a spa offers could help immensely. So that was really sad. And I think it's sad that at a time when people are going through hell, that those beautiful services are not open to them in any shape, sense or form. And you know, even my Reiki healer, who was absolutely amazing, and you know, I am so grateful for everything that she has done, she too was very conscious that she felt that she didn't have the skills or the expertise to do any level of massage on somebody going through chemotherapy. Again, which is really sad, because in the chemo chairs where before COVID, we had volunteers coming around who would give you just, just a simple hand massage or a foot massage. And just something as simple as that takes you away from, the pain, the stress, the hell that you're going through. And it's just really sad. And I think if the medical profession could work more closely with the kind of the holistic and the spa professionals, so much more could be offered to people going through the worst time of their lives.